Let's talk about blood work to get tested if you feel like you're stuck in a fight or flight state. If you feel stuck in fight or flight, and no matter how much breath work or mindset work or journaling you do, it just feels like your symptoms keep coming back. If you feel wired, overwhelmed, or maybe your sleep is off or your digestion feels weird, or your anxiety feels physical, then you found yourself in the right spot. I'm Dr. Bisleen, I'm a naturopathic doctor, and over the years, I've helped thousands of people regulate their nervous system by looking beyond just stress management strategies. And here's what most people are never told. You cannot calm a nervous system that is being biologically provoked. In this video, I'm going to walk you through the exact blood work I use in my practice to uncover the root drivers of nervous system dysregulation. Because once you identify what's fueling the stress response at the physiological level, you can build a treatment plan that actually works. So let's break it down. Got my handy dandy markers here. So the first hormone that we are going to talk about and look at is insulin. This is such an important hormone, and honestly, most doctors aren't even testing it, which is such a shame. What most doctors will test is that they will test your, let me write it here, they'll test your HbA1c levels. So that's essentially your long-term marker of your blood sugar levels. It changes in about 3 months. And then they'll also test your fasting glucose levels. So what this does is this allows us to see what your blood sugar and fasting blood sugar is in a specific moment. Now, insulin is a bit different. So if you're just like, insulin, fasting glucose, like what is even the link between the two? Let's start off with that. So say you eat a piece of bread. Let me use a different marker for this. Say you eat a piece of bread, okay? Your body is going to break this bread down into essentially a glucose molecule. Now, glucose is very important, right? Sometimes I think that our blood sugar or foods high in glucose get such a bad rep, but glucose is actually very important. It's our body's primary source of energy. Your organs, your brain, they all require glucose for fuel. So say you did like a pretty, intense like leg workout, and your leg muscle now needs glucose as energy. What's going to happen is that if you eat this piece of bread, the glucose is just going to go outside of the leg muscle and it's going to wait outside. Glucose can't just enter like this. Your little leg muscles, or maybe your giant leg muscles, depending on how much you work them out. I have little leg muscles working on it. So your leg muscles have all these like little doors, okay? AKA receptors. I'm just trying to use doors as an analogy. And essentially these doors are like locked. So glucose can't actually enter. What ends up happening is that your pancreas releases the hormone insulin. So your pancreas detects that there's been a rise in blood sugar in your body and it releases your hormone insulin. Insulin is then what goes, let's use a different color for insulin, we'll make it green. Oops. So insulin, okay, it's green, goes and it essentially binds to these little receptors. So I want you to think of it as like a key to a door, okay? Insulin goes and binds to these receptors, and then what ends up happening is now these doors actually open and the glucose can enter and be used as energy. So that is the relationship between insulin and glucose. It's a very, very closely linked relationship. The more glucose that's released, the more insulin that's released. Now, what happens over time is that if we have eaten foods in high sugar, if we're eating all day long, what ends up happening is that these little doors, these receptors stop becoming as sensitive to insulin. So think about it. At the age of 25, if you had a cookie and it took your body 5 units of insulin to use up the glucose in the cookie, at age 30, it now needs 10. At age 35, it now needs 15. At age 40, it now needs like 50 units of insulin. And that is what is referred to as insulin resistance. Insulin resistance is so common. And what's wild, and it's really sad, a lot of doctors don't test it. Before you see any changes in glucose or your HbA1c values, you're gonna see changes in insulin. And it can take years and years and years of insulin resistance before you start seeing changes in these values actually showing up. But that doesn't mean you don't experience the symptoms of insulin resistance. So some signs you could be insulin resistant. You feel slow and sluggish after you eat food. You have mood issues. If you go too long without eating, you start to feel hangry and food makes you start to feel a bit better. So insulin resistance can be driving so many conditions, and it can also dysregulate your nervous system state, because if your body has to work like 100 times harder to use up the glucose from your food, that's going to put so much stress on your body. We don't realize it, but digestion is a really heavy process. on our body. And if our digestive system has to work that much harder to process and our body has to take up so much time to use up that glucose, then what's going to start to happen is that it is going to take away resources from everything else, because that is the number one thing that your body is going to prioritize in that time. So testing your insulin levels becomes very important. It's a really simple fasting blood test that you do. And depending on what your levels are, it can indicate if you're insulin resistant or not. And that is something that you want to take care of right away. The next hormone that I get pretty much all of my dysregulated patients to test is their cortisol level. So cortisol is your stress hormone. It gets a pretty bad rep, but your body needs healthy amounts of your stress hormone. One of the times that it needs it the most, and what it's really helpful in when we look at our cortisol, is that it helps us to get out of bed in the morning. So let's say this is 6 a.m., this is like 9 p.m., say this is 8 a.m. Your cortisol, and this is what actually peaks in the morning, and this is what actually helps you get out of bed in the morning. And then your cortisol essentially, maybe not at that level, but it kind of just like goes down the rest of the day. So it peaks at 8 a.m., helps you get out of bed, and then it goes down the rest of the day. So much dysregulation can occur in your cortisol levels. And a lot of us think that when we're in this dysregulated nervous system state, it just means our cortisol levels are actually really, really high all the time. So a lot of people just assume that my cortisol levels are just like, woo, like all the way. It's like just high all day. Not the case always. Your cortisol levels don't have to be high always for you to experience dysregulation in your nervous system. And what I am actually seeing in my practice is so many of us that are stuck in this dysregulated state, our cortisol, so it should normally kind of peak like this. It's not even really peaking that much. And we're having really a lot lower cortisol levels than normal. And because of those lower cortisol levels, our body is significantly struggling. And some of my patients, they do tend up having very high cortisol levels. It just depends on where you are in that stress cycle. Because what starts to happen with the stress cycle is when you experience a stress, your body turns on that sympathetic nervous system state, which is your stress state. This state can only be on for so long before you enter burnout, which is like shutdown. So depending on where you are in this like stress cycle, people who have just had an initial stressor, they might be in this state where the sympathetic nervous system state is turned on, and that's when you're going to see this high cortisol, versus when you're in that burnout shutdown state, you're actually going to have a more blunted cortisol response, because your body can only stay in that high stress state for so long because before boom, it just completely comes down and it just like shuts off. So when it comes to testing cortisol levels, again, this is like a blood test that you can do. I usually always tell my patients to go as close to 8 a.m. as possible, because we're trying to see what their cortisol response is and how much is it peaking up or not at all. And then based on that, patients are getting an appropriate protocol for them that includes sleep support, that includes morning cortisol support, so that we can make sure their cortisol is rising, and then also making sure that it's coming down. Sometimes we can have cortisol levels that peak and start peaking again throughout the day. So we want to make sure that they're peaking at the right time and they're slowly coming down the rest of the day and not essentially peaking up again. Now, the last hormone that is also very important to get tested that I tell my patients to usually get is called DHEA. Oops, let's not have this fall. Yes. How DHEAS works, I'm not even going to try to pronounce this hormone. I always try to do it and then I butcher it. So cortisol, think of it as like your day-to-day stress hormone. DHEAS is your stress reserve. So when we are in an extremely depleted state, we're going to notice our cortisol and DHEAS starting to decrease. And so I don't just like to test cortisol levels, I also like to see DHEAS, and I like to see what my patients' stress reserves are at. Because if they are, extremely dysregulated and even DHEAS is going to go down, it's going to completely shift the protocol, because it means that I need to give them much stronger supports so that not only are we managing that day-to-day stress hormone, but we're also making sure that stress reserve is really nice and healthy. Because if you don't have a nice and healthy stress reserve, your resilience and capacity to handle stressors, to improve, to get better, significantly decreases. So we really have to make sure that DHEAS and cortisol are working in conjunction together. The other reason why DHEAS is important is because DHEAS allows us to get an understanding of how adaptable your stress response is. And having an adaptable stress response is very important because we want you and your body to be in a state where you can adapt to stressors, where you can have something stressful happen to you and you can actually get stronger from it. But if you don't have any of this stress reserve response left, you don't have the capacity to adapt to things. So stressors are going to happen to you and you're going to feel like crushed by them instead of feeling like you can actually adapt to the stress. Because what a healthy nervous system actually looks like. So let me show you here. A lot of us think that a healthy nervous system is one that stays in calm all day long, but that's not true. A healthy nervous system is one that is adaptable. It's one that gets into the stress state, comes to calm, gets into the stress state and comes back down to calm all throughout the day. And what starts to happen over time is that if you have practiced resilience, if you've practiced moving through the stress response in a healthy way, instead of it being like this, you're going to be more like this because you're going to be more resilient to the stressors that are showing up in your life on a day-to-day basis. And this is exactly what we want. So I wanted to end this video off with a little bonus of just some nutrients you should also be testing if you want a healthy and strong nervous system state. Okay, my entire whiteboard fell down, so that was not good. So let's go through the nutrients. So number one, we have vitamin B12. So important. I don't know why I wrote the arrow here. I just meant to write the vitamin. Vitamin B12 is extremely important when it comes to mood, when it comes to energy, and it can literally affect your neurotransmitter function. So when we think about our GABA, calming hormone, serotonin, our happiness hormone, dopamine, a reward hormone, not having enough B12 can affect all of these functions of these neurotransmitters. Next is vitamin D. We know the importance of vitamin D for mood regulation, for energy function, especially if you're someone who lives in colder climates. I live in Toronto, Canada. So checking vitamin D levels, making sure that these are healthy are so important. And let me tell you, every single patient whose vitamin D levels I check they're low. They're low. And oftentimes, even in the summer, they're really low. So it doesn't matter, even if you live in like a summery, sunny place, still get your vitamin D levels checked because you might be surprised they might actually be low. And then lastly are your iron levels, especially if you're a woman who's menstruating, please check your iron levels. Iron basically helps your body carry oxygen and get oxygen because iron is responsible for carrying oxygen to different areas of your body. So if you don't have enough iron, your brain, other areas of your body literally are not getting enough oxygen, and we need oxygen. Every single area of your body needs enough oxygen. So super important to test your iron levels and make sure they're in a healthy, optimal range. You know, women actually need their iron levels, you know, for fertility wise, minimum 50, but optimally should be closer to 80. And oftentimes I rarely ever see those values. So super important that you do test your iron levels. So it's important to test these nutrients as well. I didn't go into like comprehensively every single thing that I would test for my patients, but I did just want to share kind of the top 3 hormones that I would test, the top 3 nutrients that I would test. So really important to make sure that you're doing lab work and that you are getting a plan for your nervous system state for yourself based on the lab work that you are actually doing. Lab work is so important. No patient comes with me, works with me without getting lab work done, because why do anything randomly when you can get lab work done and get a more personalized protocol? So if you do want personalized nervous system support, I would encourage you book a free discovery call with me and we can chat about what support for you looks like.